So my name is Nick Clark. I'm a nurse practitioner, family nurse practitioner. Have been for a couple of years now. I started in nursing in 1996, graduated with my associate degree and worked for about 21 years in the emergency department, and just felt that I could better serve people through becoming a provider, and so I took the dive and went back to school and finished that up in 2018. The best thing is the role change from being a nurse to nurse practitioner, just the ability to provide access to care for people. It's a very different role than being a nurse as a provider, and so I feel like I'm helping provide access for some of those people who may not be able to find care themselves. Well, I've been with Peterson Medical Associates for the past 2 years, ever since I graduated. It was a very natural transition for me, having been with Peterson Hospital for so long. I think what really sets them apart is just the camaraderie, the amount of providers, the ease of access with the providers, and the diversity of the providers. I mean, we have all different types of specialties, and from my standpoint, they are all very approachable with questions, and has been a very good experience for me. I'm a local person. I grew up in Fredericksburg, and so been here basically my whole life. Well, having been born and raised here, it's one of the better places in the world to live, I believe. I've been to a lot of different places, and the small town atmosphere, the safety that I feel when I'm here, it's definitely different than the hustle and bustle of big cities. I have kind of an interesting role here because working with so many different providers. Part of my role is helping to provide more urgent access for people, and so a lot of the most common things I see are the seasonal things, upper respiratory infections, injuries, just a large variety of things. There's not any real specific trend with what I do, but I kind of help out with all the physicians seeing their patients in a more timely manner. When I'm not at work, I'm usually outside. Doesn't matter what I'm doing, whether I'm farming, ranching, fishing, doing things with my kids, enjoying sporting events, that sort of thing, just about anything outside. I love Peterson Health because it's been a very good place for me to work. I have been here for now 21 years, and I did leave for a short stint for about 6 years and worked only part-time to pursue a dream of flying with one of the air medical companies. But other than that, I've always come back, and I feel like it's a great company to work for. They've always treated me exceptionally well, and I think if you put in the hard work, they're very willing to reward that.